On this episode of the Ask Mike Reinold Show, we review a recent journal article published that discusses the return to sport and activity rates between ACL reconstruction and non-operative rehabilitation.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the podcast. We are here answering your questions, but also reviewing some journal articles. So we're working on some new formats here. We're almost at the 10-year mark of this podcast, which is crazy. I don't think anybody really listens to it anymore, but we enjoy recording it for those very few people that are still listening. Thank you for that. We are here at Champion PT Performance up in Boston. We have another journal article to review today. We have Kevin Coughlin, Lisa Lowe, Brendan Gates, Anthony Vedetto, Dave Tilley, Lenny Macrina, and Mike Scaduto here. And we're going to be going over another journal article review for your pleasure today. So what do we have today? We have, this one was just published in July of 2025 in Sports Medicine. And Len, you're more on Twitter than me here, but I'm going to say that this one was discussed quite a bit on social media recently. But the article is "No difference in return to sport rate or activity level in people with ACL injury managed with reconstruction or just rehab alone."
Right.
Len, what do you think of this article? What's your review?
Yeah, when this article first came out, it was, it kind of hit a lot of areas of, common conversations that we have on social media. It was, it's one of those like, oh, okay, what do we got going on here? Because, there is obviously a population of people that could probably get away with not having a surgery. And so this paper came out and was like, oh, maybe we can expand that group, and maybe surgery is not as viable as we have said and believe and promote. And so you look at the paper, and I appreciate what the authors have done. I don't know the authors at all. They're out of, I think Stephanie's out of Australia. She's put other papers out on cross-bridge non-surgical interventions after ACL. So, take it with a grain of salt. I tend to have biases as well. And so the paper, when you dive into it, is a little, I think there's some flaws to it that I think once you dive into it, you're like, all right, maybe the conclusions that were drawn, I would take it with a grain of salt, because, they were able to whittle it down to about 18 studies of about 1,600 participants. So it's a meta-analysis and a systematic review. So they did a big lit search, and they whittled it down to what met their inclusion and exclusion criteria. And a big thing was that the paper had to compare surgical versus non-op rehab, and then see if the groups had a significant difference in all those papers, and then bring it down into a clean meta-analysis and systematic review. And so there was, their conclusion was there was no significant difference in the groups that had ACL rehab or rehab alone. If you look at their return to sport injury or return to pre-injury rates, it's only about 45 to 50% in the studies included. If my ACL patients had a 45% chance of getting back to sport, I don't know if I'd still be in business. So, those numbers seem low in general. I think another thing that they looked at as well was the lack of we don't know the pre-op status or the pre-injury status of the participants. They were, seems to be an older group, not all athletes. Definitely there were no elite athletes. And they say that in their conclusions that, you cannot generalize this to elite or, higher level athletes. So we're generalizing it, I think, to basically an adult population. I think you can maybe say could do a trial of non-op rehab, but they can't say that for certainty. Most of the studies had significant confounding biases and had very low and serious uncertainty and risk bias associated with them. And I'm talking almost all of them. So when you start looking at, if you take studies that have biases associated with them and try to come up with a conclusion, your conclusion is going to be biased. I think that's what we're coming up with here is this meta-analysis and systematic review seems to have what they determine as serious biases associated with them. So I would say the conclusions have serious biases as well. So I think take it with a grain of salt that you compile all this data. And again, I appreciate what they did. I don't think this is swaying me. Again, I have my internal biases that I treat all post-op patients. I've spoken to numerous PTs. We met about this in one of our sports medicine society meetings. And most people have read it, say that they appreciate the research, but there needs to be more work to be done to compare apples to apples. So I open it up to you guys and who read the article and just curious what you guys had to say as well.
What do you got, Dave?
Yeah, I think for me personally, when I read articles like this, like it's a pretty bold statement to say like, there's comparable rates and you maybe don't need an ACLR, stuff like that. So like as someone who also does research, you try very hard to make sure that when you say something that's a little bit more spicy, you're really having a lot of pretty solid evidence to back that up, right? So like the only parallel I can say is like we worked on a paper where we talked about elbow OCD and weight bearing in gymnasts, and we were recommending that people start weight bearing earlier than maybe the recommendation was. We had to spend like years digging through papers to defend why biologically we thought that, what the surgeons thought, whatever. So that's always for me is like, wow, like, okay, to Lenny's point, if I'm going to make a discussion point about this, I got to really make sure that all these studies are pretty hardcore methodology. They're long-term. And for me, I like highlighted it to read it, but it says at the very end of the discussion, it says, however, it is known that some individuals managed non-surgically will not regain the knee stability required for taking part in cutting and pivoting sports. For individuals with persistent knee instability after trialing non-surgical management, ACL reconstruction is recommended. So for me as a clinician, the ultimate goal is what? Safely get them back to sports and then not get that dreaded text that like, hey, I was playing last night, something went really quick, I felt the pop, I'm getting an MRI, and like your heart sinks, right? Like, so for me, that's always the end goal of like, I need to make sure this person gets back. Saying you got back to sports is one thing, but are you successful at sports for many, many months, many years after? And for me, I need like a 1, 2, 5 year follow-up on really long prospective studies to say someone got back to full level, they didn't get hurt again, they didn't have a reconstruction later down the road or a meniscus tear. And that's kind of where I kind of started to feel a little bit on the fence about this and like how hard you can kind of lean on these results is because I think that's what matters the most is someone is 1, 2, 5 years out. They didn't have another knee injury. They didn't feel unstable. They didn't tweak their knee, then take a month off, then tweak their knee, then take a month off. Like that for me is always what I think we see a lot of is that people who are ACL deficient, if they're going back to really high level sports, there's always this kind of like instability fear, even with the brace, even with great strength conditioning, whatever. You never know, cutting, pivoting, field contact, especially like you got people running into you all the time. You got girls trying to kick your legs for the ball and stuff. So that's always what I think about when I read a paper like this is like, you got to have some pretty hard legs to stand on from a research point of view to start making these claims.
I thought it was kind of funny, like just to add to that a little bit too. I was like, what is return to sport? You return to sport without an ACL, right? So yeah, you play one game and then the next week you blow out. But like, I'm not saying that happens to everybody, but like if that were the case, that person returned to sport, I believe in the criteria of even like the study, which I thought was kind of crazy. So, very interesting. I want to hear other people. I saw a bunch of hands go. Lenny, just real quick. 48% of the ACL reconstruction group returned at 12 months. How does that stand to the norm? 48% of the ACL reconstruction group at 12 months return to sport. That seems low and slow.
Right, and that was the point that I made earlier was it's 45 to 50% in the study return to sport at 12 months. Then we're missing something. And again, there's no standardized protocol. Like there's so many different variables that are associated with this. What are the graft choices? What are the patient populations? Male, female, the ages? How were they? What sport did they play? The last sentence of the paper, literally before the final conclusion, section 5, is studies included mostly adult participants, and no studies included elite athletes. So the findings cannot be generalized to children, adolescents, or elite athletes. So again, pump the brakes with the conclusions. But again, an adult population, maybe you talk about it, or you talk about like an allograft, or something like that. Again, that's surgical. So we have to be careful because the conclusions that are drawn, that are spoken in this, are that the outcomes are the same with surgical versus non-surgical treatment. But then you can't say that to everybody. It's just literally you got to read the paper carefully and look at the limitations to the paper. And maybe an adult could get away with it if they're going back to a relatively sedentary lifestyle, which the Tegner scale, which is used throughout the paper, looks at work and as activities like sporting activities. It's not an ACL specific, or it's not a athlete specific. It's did they get back to a work or a job or something like that. And so that's another flaw of the paper, is the scale that they were often using in these papers were not necessarily ACL specific and sports related specific.
Mike, what do you got?
I mean, I don't know if I even want to say this. As someone who doesn't have a Twitter, I don't know. I don't know if I take issue, or I think that the title of the paper itself was, very purposely made, I think, to garner a lot of attention, but they kind of hedged the bet in the name of the title, because it says return to sport or activity level. And sounds like, based on, what Lenny was talking about, that maybe this paper is really looking more at the activity level. It's not really looking at return to sport, but you want to get people to talk about it on Twitter. I think return to sport in ACL is the hottest topic. So I don't know. I think, again, I don't have a Twitter, so you can't find me, but I think that was maybe a little misleading on my end.
Well, I'm just going to add to that a little bit too. If you dig into some of these papers, they talked about that the rehab was performed on low-level activity people that did not want to return to sport, and some were told not to return to sport.
Right. Exactly.
So, yeah, no wonder why the rates are so low, right? But, yeah, I mean, that is an interesting one. But Brendan, what do you got?
I'm thankful that they mentioned that in the paper.
Yes, Brendan, what do you got?
Yeah, I too just kind of shudder thinking about the TikToks and Instagram videos that are going to be made with this headline without really looking at the population that they're talking about. So I feel like they should just add on in middle-aged people at the end of that title. And yeah, it just kind of worries me. People take this and they look at the title and they just say, well, hey, like my 17-year-old soccer player, maybe don't need surgery. I just feel like we need to really highlight some of those differences, like Lenny said.
And I'm hearing that as well. I'm getting an uptick, definitely, and not because of this paper. I'm not blaming this paper, not at all. It was before this paper came out, but I'm hearing an uptick of parents coming in and like trying to convince me that their 16, 17, 18-year-old son or daughter does not need surgery. I got a kid right now actually walked in the door this past week or late last week who is going to not do a revision surgery after his primary ACL reconstruction. For other reasons, for numerous reasons, the doctor said, let's just go non-op and see how it goes. Let's try to get you through your fall season. And he's going to strength train with us. I've spoken to the kid a bunch, let him know the risks. He understands everything. And he's going to try to not do a revision surgery and try to get through his soccer season, this high school year, this fall. And fingers are crossed. But he understands the risks. And I've talked to him and even training with us and all that. So we'll see. But there's been a little uptick in parents wanting to discuss non-op rehab for their high school, child.
Well, you could tell them, Len, based on this paper, if you don't want to return to sport, you have a 48% chance of returning to sport, which is great.
Right.
I mean, that's
right.
kind of what it says. If you don't want to, or we're told not to, you still have a chance, I guess.
Yeah,
is what it is.
Flip a coin.
Yeah. Can I stir the pot with one other thing? This is kind of interesting here. Did you notice that the definition of the surgical group could have included up to 30% repairs and allografts?
Yeah. I meant to mention that I had that highlighted as well.
Holy smokes! Yeah. So, all right. So, what's the percentage of allografts that repair versus an autograft? Just an example. That would increase the ACL reconstruction group a lot higher, even if you just standardize that a little bit better. Because if you do a repair and allograft, you're already saying this person probably isn't like a D1 collegiate football running back.
Low
right?
activity.
Yeah. You know what I mean? Like it's almost like inherent that was in there. But what else? Who else wants to jump in? Anything? Anthony, what do you got?
Yeah, I was just going to go back to what Brendan said about these screen grabs putting on TikTok and all these kids are saying, oh, maybe I don't need ACL surgery. Well, what about clinicians who don't read the paper, don't have access to the paper, whatever it may be? They just see the headline and now they're recommending to their 16, 17, 18-year-old patients, well, maybe we try non-op and then maybe down the road, if it doesn't work, we get ACL surgery. It's like these kids don't have enough time in their high school career, college career to take 4 or 5 months to trial non-op and then go through 12 to 14 months, whatever it is, of a surgical protocol. So like that's just a tough situation to put a 16, 17-year-old kid in when they just don't have the time to do that.
In the follow-up paper could be the incidence of OA and total knee replacements in these groups 5 to 10 years from now, which is, a whole nother conversation of what you're doing. That's high enough alone in ACL. I can't imagine the percentage compared to reconstruction versus a non-operative rehab. I don't know. Does that exist, Len?
I feel
That's a
like
tough study.
that is tough. I feel like there are people that are arguing that there's no difference if you have surgery or not. Like, so why do the surgery? And so yeah, I mean that's the other side's argument. But I tend to be more surgical. I guess I grew up with that. I'm biased in that and who I treat. So I treat high school, college athletes and adults, but they are active adults. And if you're active,
Right.
it seems like this study is not helping me convince my patients to try non-op. But sorry, people online. I know there is a whole world that wants this, including some of our friends. Yeah.
No, I think we can say if you don't want to return to sport, then your chance of returning to sport is similar. That's kind of my take home from this study, right?
Yeah.
It's kind of a weird way of saying it, but Kev, what do you got?
Yeah, I definitely agree with all the points that have been made so far. The other thing I'd say is that a study like this just needs to be put into context with all the other studies that have come out, because I remember looking at some of this stuff with Dan, and there's plenty of research to show that if you're a higher activity level and a younger age and you play like a type 1 cutting sport, your chances of successfully rehabbing without surgery are very low. So we can't look at one paper that, like I think Mike Scaduto said, if you have a catchy headline, and like Brendan and Anthony said, you might run with that and think that, oh, there's new evidence emerging that we don't need to do surgery in these athletes. Well, it needs to be looked at in the context of all the other papers. So maybe it's an interesting thing to keep an eye on and see if there are like new randomized controlled trials of higher quality that come out and show this. But you can't forget all the other good research that has already been published that has answered this question in certain populations. So that's just the only other thing I'd say is try to keep that stuff in mind as well.
Yeah, and I'm going to go off topic here. I was deciding if I wanted to do this or not, but like I can't tell you how much it pains me to see clickbait and like these misinformation, misleading type titles like in our mainstream media. This is going into our research now and our journal articles. Oh my gosh, people. Like, like that's my thing. Like you cannot do clickbaity stuff in a research article here. We are medical professionals. This is scientific. And I know like this is, nothing against like the authors here. This is not an authorship thing. This is the journals. This is everybody kind of doing this. And it's not right. I just think we just have to be very careful here, because what I've learned over my career is the majority of people don't read research. The few people that do don't get past the title. The very few people that get past the title don't get past the abstract, right? So that's part of why we're kind of doing this like here. But like I think this is a really good example of like if you start getting into debates about this online, you got to know all the details, right? There's some merits to this study, right? This is a good study that shows some things like rehab on low level people. I think it actually opened my eyes that and I say low activity level, like low what do they want to return to? It's actually opened my eyes that it may not be a bad option for some people, right, that don't want to go through it. So there are definitely merits to this whole thing. But man, trying to get people to debate this online and those contrarian social media accounts that just want to like say all these things, like you have to put it in context, just like everything else. One ACL is not the same as another ACL, and one patient's not the same as another patient. So you got to be really careful with that. So little soapboxy, man, but like I hate to see that this is where we're going in that direction. But anyway, appreciate it. Great review. Thanks, Len, for going over that. Again, if you like this sort of stuff, the journal article reviews and kind of hearing us a little bit here and how we're thinking through these studies, let us know, right? Send us some messages, email me, DM us on social media, because we kind of want to know if you like the new format. And please, rate, review, subscribe. We'll see you on the next episode. Thanks so much.